Welcome back to another PT Pro from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
And today we're talking about squat variations. So let's think about back squat, front squat. What really works the glutes and what is the perfect stance? Let's talk about it.
So today we're diving in a little more on squats and what different type of variations of squats there are, why squatting in general can be beneficial to do as a part of your routine, and really just the benefits of different styles of squats.
Yeah, and we're going to be demoing with our PRX equipment, which is pretty dang dope, especially if you want to build in like your garage style gym without taking up much space at all.
Yeah, we saw this in a friend's gym, and he basically had one stall of a garage that he was using, but the way that everything folded up into the wall or stored on the wall, if you're watching on YouTube, you can see this setup behind us. It's so clean looking. And if you're not looking for a massive rack, they have dumbbells, they have slam balls, kettlebells, boxes. So anything you're looking for, and a lot of versions of it, they have like the space saving style. So
yeah, exactly.
Why is it beneficial to squat? Why should we be squatting?
I mean, it's in everyday life. And this is what we call ADLs, activities of daily living.
Yes.
It truly is something that is a part of life. It's really hard to avoid squatting, right? You know when you have to avoid it, like, ooh, what can I grab onto to help me? Or how can I maneuver my foot somehow to pick this thing up? It's a part of life. And so the more we avoid it, the more problems we actually end up creating within our body.
It's heartbreaking how many people I've worked with that like that's their goal later in life. It's just like, I just want to be able to get up off the toilet on my own, have a little bit of privacy when I'm going to the bathroom. Sitting to standing or squatting is essential to life.
It's going to help improve not only your strength too, the more that you do, but also your mobility. I think we've been taught a very poor mechanical way of squatting to avoid knee pain. Stick your butt out and squat
back
into your hips and don't let your knees pass your toes. Can your toes lift off the floor? Like these are all the cues. As a Pilates instructor, I used to use, we have to get our knees bending over our toes, our ankles bending, our hips bending. It's essential into life. So that's what squats bring you.
Squats are very good, just axial loaders, or what we call like something that's going to load us basically head to toe, especially if you're doing a variation where you're holding a weight like a front squat in front of you or back squat on your back. It's loading you all the way through your spine, through your hips, down through your legs. So it's really putting a lot of pressure and weight through our bone structure, and it can be very good for bone density. And just in general, squatting is great for building tendon and muscle strength and being able to help us keep that strong and able as we get older in life.
I've gotten DMs or people reaching out who've said, well, my clinician told me never to load my spine, so I can't lift weights. And I'm thinking, you're loading the spine the moment you stand up. Are you going to hold a baby? Are you going to hold a dog? Are you going to hold something in life?
Carry groceries? Are you going to
You're loading your spine. So we get to actually practice that and exercise that in life.
And the more that you avoid those types of things, the more you're setting yourself up for failure when you eventually will need to do something in life. Like you are going to need to pick something up. You are going to need to, at some point in life, grab something that might be heavier than you're used to. And if you're not training that, you're setting yourself up for failure. Somewhere in the kinetic chain of your body, something's going to fail.
So let's talk about, some different squat types. And there's so many variations. 100% we're not going to touch on all of them. Okay. We're going to touch on some of the big ones, the basics ones. Some you've probably seen on YouTube or social media, or you've seen in the gym. But before we even get to that, let's talk about squat stance. I mean, I think that's a very also controversial topic a little bit, and you're going to hear different things from different physical therapists or trainers.
One thing that I know Jen loves to do is say, just jump quick in the air and land on the ground. And however far apart your feet are, however they're tilting, in and out, if they're pointing straight forward or if they're slightly out to the side, your body's pretty intuitive and it's generally going to find a good spot for you based on your limb length, based on some internal anatomy, where your feet should land to be able to squat effectively.
And I do love that one a lot because I go to it. I will admit the limitation of that is that your body's natural way of like, oh, this is what I should be doing or compensating, or this is what I've learned. So it's like there's limitations in that. All of these are just guesstimates. Sometimes you could just like walk your feet out and like without looking, just close your eyes and go back and forth for a while wherever your feet and legs comfortably land. Okay, good. That's where my body feels comfortable.
And this is where in kind of my daily routine, I love to do squats in the morning. And what I do is I do 4 or 5 sets, all with different bases. I have a really wide squat, and I make sure that I'm focusing on keeping my knees out and not letting them come inside of my feet as I'm squatting. And then I'll go a little more narrow. And then I'll get to the point where I almost have my heels together. And how low can I get in that? How far can I push my ankles into that dorsiflexion and push my knees out over past my toes to get into that super narrow squat?
Being aware of your limitations is great. That's why it doesn't have to be narrow. It doesn't have to be toes facing forward. I've also heard in some lifts and the way that some of them are taught, you want your toes more forward because when you squeeze and activate through the glutes, you're not going to have as much range to have to pull from. You kind of lock into this good spot, quote unquote good, whatever that means, rather than having your feet already a little bit out and then having to rotate more from there.
With that, let's dive into different types of squats. And I think just to simplify, if I were to say like there are 3 main categories, it has a lot to do with where the weight is, if we're using weight. So if you're using a load like on your back squat, great. I guess not even 3 categories, but like where is the weight? And it's this spectrum of, are we having the weight on our back? Because we're going to talk a little bit about a low bar back squat, a high bar back squat, and a front squat. And where that weight goes is going to really bias what our body does in order to squat up and down. And then there's a lot of variations of squats where we're changing the base of support. Like if we do an unbalanced staggered stance, different split squats, and that's going to change up a lot of what our body needs to do that squat effectively.
Know that we each have different lengths of the long bone in our leg, which is called our femur. We know that we have different structures in our hips and the way that some are rotated a little bit forward, some are rotated a little bit back. Our bones are resting inside the socket, just a little bit different angles. And all of this contributes to a squat that feels better for your individual body. Within what we're going to talk about for each of these, it's going to change based on your anatomy and your body's natural tendency into some of these.
So back squat.
When you think of lifting with a barbell especially, I think this is like one of the first lifts that people tend to think about. So we have high bar back squat, we have low bar back squat. So
a low bar back squat is the bar sitting lower on your back. It's not on top of your traps. The bar is like kind of lower on the back of your trap. So what this is going to cause you to do when you squat is it's going to make you bring your trunk further forward. And also because of that, you're getting less ankle range of motion. It tends to be maybe a wider stance versus a more narrow stance. It's going to bias you more into having glute activation.
Because you're forward folding.
Yeah, because you're forward folding. So your glutes need to work to prevent that and control that trunk translation forward. Your back, your spinal erectors, especially in your low back, are going to be working a lot, and your upper back for that matter. So it's really causing you to hinge more at the hips and keep those knees kind of in that vertical position over the ankles with less forward translation.
And the more that we bend at the hips, the more that you're going to get more glute activation. This is what also bothered me when everyone's like, oh, you want to grow the glutes? Like do squats. You're not going to just grow your glutes. As we're squatting, we're bending our legs. So we're also getting quads. We're also getting our core. We're getting our back working. We're getting our hamstrings. It's a lot of our full body kind of working together. Just some of these are going to bias a little bit more. So can low bar bias a little bit more into your glutes? Yeah. Because you're getting more of that hip flexion. So it's going to stretch those glutes around in a greater depth. However, if you have back pain, if you're someone who's struggled with your back and you don't have a strong back to be able to handle the load that it's going to take, probably not the best for you.
Might not be the one. Yeah. And so low bar back squat was what I mentioned earlier. Like I really liked to do a low bar back squat, but one of the things I mentioned is it required me to have such a wide stance. And I think that when people tend to say like, oh, I feel a lot more comfortable with a wide stance, then the question is, okay, well, then are we maybe putting too much pressure different areas that we might not want it? Like the insides of both my knees took a lot of what I would say punishment from the way that I squatted. And so if you are electing to use a wide stance, then are we keeping those knees out?
Do we have
over
good
the
hip
ankles?
range of
Do we
motion?
have good hip range of motion? Are we getting that external rotation at the hips? Do our adductors have enough functional range to keep our knees out there? Or are we just using that wide stance because we're compensating for that ankle range of motion or any restrictions we might have elsewhere? So that's something to really pay attention to. If I have a wide stance, are my knees kind of swimming inward when I'm under load, which again, like it's always something to be aware of. And when we're doing things under load, if our body doesn't feel like it's under control, then we might be setting ourselves up for injury.
I mean, and that's another controversial topic I've seen so many talk about, like should the knees come in as you're doing a loaded squat? It always depends, but it's what you're training and what your body is set up for. If you know that in order to get up, your knees have to come in toward each other, and that's the only thing that you're able to do, then you don't have good control. We should be able to control our knees staying out, especially as you're starting squatting.
I was going to say, I think a lot of the controversy comes when people are talking about like high level.
Exactly.
Like there's like, oh no, you can let your knees swim in. That actually creates more of a torque or gives you a better like stretch action. I'm just like, well, that's because you're trained in it. If somebody is untrained and under load and their knees swim in, they're not controlling that. They're not doing it because they're trying to push their max squat up.
Exactly.
There's a difference between somebody who trains back squat and is trying to push for max lifts versus somebody who's trying to train squat for function.
The same with when do you use a belt for squatting, right? When you have control. A belt isn't going to do it for you. You have to be able to control your trunk and your core under load before getting a belt.
Moving from low bar back squat, like the next step is, okay, people will have a high bar back squat. What's different about high bar back squat?
Well, I think people get confused on this as well. It's not in the neck. It is actually on your upper traps. So if you were to kind of like shrug your shoulders just a little bit or think about rounding your shoulder blades a little bit farther forward, you might feel your upper traps kind of pop up. That's where the high bar is resting. So it's still in muscle, it's not on bone. When you're getting started, use no weight on the bar. Feel like you can, where your upper traps are, use a coach. Get started with a trainer, get started with someone who's going to help you like, oh, these are your traps. This is muscle. This is bone. Put it on muscle. Okay to get started that way, right? So a high bar back squat is going to be higher up onto those upper traps, and it's going to require a lot more ankle range of motion and a lot more knee range of motion. So it is going to naturally bias a little bit more into your quads. You're still going to get glutes, but again, it's going to be a little bit more quad dominant than a low bar.
Yeah, and this is kind of where we're moving down this spectrum towards what would then be your front squat, which as the weight comes more forward, okay, now our torso is going to be a lot more upright. We're going to need maybe even more ankle range of motion to get the knees forward over the ankles. Our core, anterior core is going to activate a lot more versus the back, like we were seeing in the low bar back squat. And it's going to be a lot more direct axial loading through the spine, where our spine's a lot more vertical. So we're not getting as much of that shear force, where if we're doing a low bar back squat, our spine's kind of at that diagonal and you're going to get shear force coming forward, which again, isn't a bad thing. A lot of people think that that's like an awful thing, the shear forces we put on our back in a low bar back squat, but you'll just see less of that in a front squat.
And then we go into a safety bar, and some people might have seen this. So this is where you have like the handles that come out in front of you. So it acts almost like that front squat position, but your weight is still a little bit further back and a little bit balanced. This is really, really great if you have access to a gym and you have access to the safety bar. If you're just getting started in squats, so you're still more of like a beginner, or you're rehabbing from injury, because the way that it disperses the weight, it's not too much on your back, it's not too much on your knees. You're a little bit more upright and your whole body's kind of a little bit more balanced and working together under this load.
And it's great for people with shoulder restrictions and range of motion. If you have shoulder or wrist or any upper extremity issues, like getting into that position with your arms back on the bar can be really intense on your shoulders or front squat. A lot of people might have issues with wrist, different variations of front squat. So that's kind of that spectrum. Like, where's the weight? How far is our trunk kind of translating forward versus us using our ankles to get our body to translate forward over our feet being our base of support. And low bar back squat, we're using a lot more of that hip bias versus a front squat using a lot more of that quad bias.
And all of this again changes just a little bit depending on your ankle mobility, your hip mobility, your core stability and support, how much you can control through your core. So it all ends up changing just a little bit.
My biggest message, because a lot of people are like, oh, what squat is best for me? You know, it's like, it depends. It always depends, which is the PT answer that we're going to give to most questions. But it's always going to depend. If, like Jen was saying, do you have back pain? If you're having back pain, okay, maybe not a low bar back squat. You know, maybe we're going to do more of a goblet squat, something with the weight in front where you can focus on good core stability, loading, but you're not going to aggravate what's going on in the back.
If you're practicing getting your knees over your toes a little bit more, getting into ankle range of motion a little bit more, putting more demand on those quads, because that's not bad, that's good. And you know that you've been someone who's been avoiding knee flexion. You know you grew up in the time where it's like, never let your knees pass your toes, always keep your hips back and stick your booty out. You know that that's been you. It's okay to, get a little lift on under those heels and start getting those knees to go forward. Start training a more upright position. That's why I love a goblet squat and retraining this. I mean, this is even working with my mom a lot. I'm retraining how she's moving in her squat because she has got great range of motion, but she stops her squat so high because that's how she's been trained. Even if her heels are lifted, and I see this all the time. I see this with friends even, that even if their heels are lifted, which the intention then is you can go down. But a lot of people will still stop their squat because my butt is supposed to be out really far and my knees are not supposed to be forward. What if we stopped doing that and we kept our chest up really high, and you just let your knees go straight over? What would happen if you started doing that? And it's going to feel really scary at first if you've never done that, but getting your knees to get strong in getting into their full range and putting more demand on your quads shouldn't be avoided.
Yeah, it's going to help build great resiliency in the body and great ability to be ready for whatever the world throws at you. However, you need to bend down and pick something up.
And if you are having like a little bit more back pain, maybe a low bar back squat isn't going to be your thing right now. Maybe not even a high bar. Maybe you need more front squat. Maybe you need more safety bar lifts. Think about what it's doing to your body, because know that all of these squats are still going to recruit all of these muscles.
Well, there you go. A talk through squats, different types of squats, what they're going to bias in your body, and how to know what your tendencies are. So comment below if you love something, if you have questions about squats, or want us to do a future PT Pearl on anything squat related. Otherwise, we will see you on the next episode.